Hi, my name is Spencer, and in this short video, I'm going to be talking to you about grief and grief counseling. So first of all, what is grief? Well, a kind of textbook definition for grief would be any significant negative symptoms that you have stemming from some kind of loss, usually the loss of a loved one. Now, from this, I would further expound on that. As a trauma therapist, one thing that I understand is that there's no one size fits all. In other words, we have kind of like an understanding that trauma is caused by going through certain significant experiences, but that really any difficult life experience can lead to very, very similar symptoms. The same is true of grief, I've noticed. It's not just something that will be caused by the loss of a loved one. It could be grief connected to any kind of loss. Common things that I've worked with people on when it comes to grief is, for example, the loss of a relationship, the loss of a job, the loss of a spirituality or a faith practice or faith perspective that they once had, the loss of a friendship, the loss of, a career path or a university path that someone had. Again, this could be limitless, the types of loss that you can experience. Now, grief is something that doesn't just go away. It's not something that you can just wake up and tell yourself, I'm just going to feel better and move on. There's a process and it takes time. A lot of people will look at it and they'll say, you could be experiencing those grief symptoms for up to 4 years. But what I like to remind people of is that you should heal from grief. Just like anything that we experience, our bodies want to heal. Let me give you an example of this of our bodies. If you get, let's say, a cut somewhere on your body is going to do everything it can to heal that spot. This might include, increasing blood flow, causing inflammation, which can help with the healing process. Lots of different things. And I won't get into the nitty gritty because I'm not a doctor, so I can't tell you on those things anyways. But needless to say, your body wants to heal. It will do everything it can to heal. The same should be true of anything else that we go through when we understand the process. And so I like to ask people, do you feel stuck in your grief experience? If you do, well, then that likely means that we need to do something, or you need to do something to shift your process so that you can process the grief. Now, this looks different for everyone, right? But again, are you feeling stuck in your grief? There's no timeline, but for you, does it feel like you've been in it for too long? Do you feel like the effects of your grief have been going on for too long? So I would just start with that as a good gauge for, do I need additional help with my grief? Now, your symptoms of grief, again, could be unique to you as well. So there's lots of different things that people tell me they experience with grief. You might be having trouble getting out of bed in the morning. You might be finding yourself feeling extra emotional. You might find it hard to be around people, things, or places that remind you of that loss that you've experienced. You might have heightened anxiety, feel just on edge or off generally, and not really have a reason or understanding why that is all the time, and a myriad of other kinds of symptoms or experiences. So again, your grief could be manifesting in a lot of different ways. So what exactly does grief counseling look like? Well, like I mentioned before, it could look like a lot of different things. There's no one size fits all. But if I were to kind of characterize it or summarize it in one short little thing, I would say grief counseling is about having a trained professional walk with you in the grief to discover and find the path to your healing. One of my favorite sayings to share with my clients is, I do not believe in torture by therapy. In other words, if we can find that path moving forward for you, then I believe that you can walk on it on your own after not that much time. Who knows what that exact time frame might look like? But as you get the help, you can find that path and get a better estimate of what that's going to look like moving forward for you. So more than anything, before I wrap up, I just want to remind you that there is hope. Healing is possible, and grief counseling is a really good way to get that help and that hope that you're looking for by, again, finding that path forward and what it's going to look like so that you can make sense of your grief, process it, and move forward in meaningful ways for you. I hope you've enjoyed this video, and I'll see you next time.